In your Commonwealth Capital Connection tonight, a bill on the chopping block this week could impact insurance prices across Virginia. Capitol Bureau reporter Jackie DeFusco is digging into whether prices will go up or down.
Well, the debate here centers on whether Virginia should stop health insurance companies from charging tobacco users up to 50% more for coverage compared to non-smokers. At least 6 states and Washington, D.C. have already prohibited that practice after some studies suggested that the fee was not working as intended. This week, before the General Assembly, should smokers pay more for health insurance in Virginia? Governor Glenn Youngkin standing by his veto of a bipartisan bill eliminating the extra charge for tobacco users.
When we in fact artificially deflate a premium that by definition requires more expense for people who smoke, we in fact have a real risk of pushing people out of the insurance market.
Youngkin says keeping that price hike in place incentivizes smokers to quit. He says ending it would lead to higher premiums for non-smokers. But several groups, including the American Lung Association, say, surprisingly, the opposite is true. And a letter responding to the veto adding, it is time to abandon this failed intervention. Delegate Patrick Hope blindsided by the veto.
The governor's veto was a mistake.
Hope says the price increase is blocking some smokers, often younger, healthier ones, from accessing insurance altogether, as well as programs to help them quit. A nonpartisan study last year finding eliminating the tobacco surcharge would bring up to 14,000 more insured Virginians into the market, improving the risk pool and decreasing premiums by up to 4.5% across the board. By Hope's estimate,
$157.78 over the year. That's real savings for real Virginians. For every Virginian that's in the individual insurance pool will benefit from this bill becoming law.
And that was Capitol Bureau reporter Jackie DeFusco. For that bill to become law, the General Assembly will need to override Governor Youngkin's veto with a 2/3 vote in a session which is set for Wednesday.